Welcome to the ELISA lab. In this lab, you will learn the basic principles of the ELISA technique and apply the concept in testing a drug to treat hemophilia patients. Let's get started. Perfect, then let's get started with your first mission.
Hi, I am Dr. Lisa, the hematologist. I am in charge of the patient diagnosed with hemophilia. I am glad you came today to discuss the treatment strategy for the hemophilia patient.
Ask Dr. Lisa some questions.
Hemophilia A and B are X-linked chromosome bleeding disorders and are caused by mutations in the factor VIII and factor IX genes, respectively. Hemophilia A and B are considered rare diseases which affect 1 in 5,000 births and 1 in 50,000 male births, respectively. The hallmark of hemophilia is hemorrhage into the joints. The bleeding is painful and leads to long-term inflammation and deterioration of the joint. In the absence of intervention, the patient with prolonged symptoms will suffer permanent deformities, misalignment, and loss of mobility. Factor IX can be used to treat acute hemorrhage in patients with hemophilia B. Factor IX is a blood clotting factor, a zymogen of serine protease, which plays an important role in the blood coagulation cascade. This cascade results in the creation of platelets for blood clotting. Treatment of hemophilia B occurs by replacing the missing factor IX with recombinant factor IX. However, we are yet to discover which cell line is the most efficient in producing the recombinant factor IX. If we find it, we can significantly reduce the cost of treatment. You are very welcome. I hope you find an effective way to quantify recombinant factor IX. Then, we can determine which cell line is the most efficient in producing the recombinant factor IX.
Wear a lab coat before starting work in the lab. Wait for the lab assistant.
Hi, I am Marie. You've met Dr. Lisa, who has given us a mission to analyze the recombinant factor IX used for hemophilia treatment. Let's assess the issue. Dr. Lisa and her team have genetically engineered human cell lines to produce recombinant factor IX. We have 3 types of human cell lines: human kidney cell lines, human hepatic cell lines, human pancreatic cell lines. We need to determine which cell lines produce the highest amount of recombinant factor IX.
Why do we need to determine which cell lines produce the highest recombinant factor IX? The cell lines produce recombinant factor IX and other proteins. Which biomolecule can specifically detect the presence of a certain protein, such as recombinant factor IX, in a sample full of other proteins?
ELISA is a biochemical assay that uses antibodies and an enzyme-mediated color change to detect the presence of biomolecules such as proteins, peptides, hormones or antibodies in a sample. Great. We know that a method called enzyme-linked immunosorbent assay, to give ELISA its full name, employs antibodies to identify a substance. We can use ELISA to detect and quantify factor IX in product samples from each cell line. You should understand the basics of immunoglobulins to use ELISA. Click View Theory to learn more.
Okay, wear gloves first before we proceed. Go to workbench 3. Sweet. Now place the ELISA plate into the microplate reader. Use the open button on the instrument. All variants of ELISA rely on the specific interaction of antibodies and antigens. There are numerous variations of ELISA. Today you are going to learn about 4 types of ELISA. Choose the type of ELISA that you want to learn about first. Direct ELISA is suitable for determining the amount of high molecular weight antigens. First, the antigens are coded to the well plate. The antigen is detected by the antibody that has been directly conjugated to an enzyme. In a direct ELISA, which components are directly attached to the plate? In indirect ELISA, the antigen coded to the well plate is detected in two stages or layers. First, unlabeled primary antibodies, which are specific to the antigens, are applied. Next, an enzyme-labeled secondary antibody is bound to the first antibody. The level signal resulting from the enzyme activity correlates with the amount of the antigen. A sandwich ELISA measures the amount of antigen between two layers of antibodies. The first antibody is coded to the plate. Then, the sample solution that contains the target antigen is added to the well. Finally, a second antibody is added, that binds to the antigen in the sample. The antigen to be measured must contain at least two antigenic epitopes capable of binding to both antibodies. If the detection antibody is conjugated to an enzyme, then the assay is called a direct sandwich ELISA. If the detection antibody is unlabeled, then a second antibody is needed, resulting in an indirect sandwich ELISA. Which component of sandwich ELISA is required in pairs? The most complex ELISA is competitive ELISA. This is common when the antigen is small and has only one epitope. Here, labeled purified antigen is used. First, the capture antibody is coded to the plate. Then, the unlabeled antigen from the sample and the labeled antigen compete for binding to the capture antibody. If there is a high concentration of antigen in the sample, then there will be a significant reduction in signal from the labeled purified antigen. Conversely, if there is little antigen in the sample, there will be minimal reduction in the signal compared to assay wells with labeled antigen alone. In a competitive ELISA, how would the signal measured by the detector react to an increase of antigen in the sample? Click View Image. What type of ELISA is shown in the diagram? Splendid. You learned about 4 types of ELISA. We are now going to quantify the amount of recombinant factor IX produced by each cell line. You first have to pick the suitable type of ELISA. Asking yourself some questions will help you decide which ELISA type to use. What do you want to measure? Great. Now we need to choose between sandwich ELISA and competitive ELISA. What is the size of factor IX? Talk to Marie.
Awesome. We will use sandwich ELISA to quantify the amount of factor IX in the samples. The advantage of sandwich ELISA is that the sample does not have to be purified before analysis, and the assay can be very sensitive. Alright, as you know, hemophilia B is treated with recombinant factor IX. To reduce the cost of this hemophilia drug, we need to determine which cell line is the most efficient in producing factor IX. Therefore, our main mission is to use Sandwich ELISA to detect and quantify factor IX product samples of each cell line. Let's carry on with the ELISA experiment. In this ELISA, we will be using numerous reagents. You have to pick the correct critical reagents required in the factor IX Sandwich ELISA. Critical reagents are defined as binding reagents and those containing enzymatic moieties. My question is, what are the critical reagents for factor IX Sandwich ELISA?
Go to the fridge and open it. Critical reagents are those essential components of ELISA whose unique characteristics are crucial to assay performance. To be able to detect a specific antigen, ELISA requires a specific and unique biomolecular interaction between the critical reagents and the target antigen. Pick up 3 critical reagents for activated factor IX ELISA. Marie tells you to pick up 3 critical reagents for factor IX Sandwich ELISA. Click View Image to see the diagram of the reagent needed. Did you already pick up all the reagents? Click on the lab pad for more information. Marie tells you to pick up 3 critical reagents for factor IX Sandwich ELISA. Click View Image to see the diagram of the reagent needed. Did you already pick up all the reagents? Looks like you're taking the wrong item. Do you want to try again or let Marie pick the reagents for you? Great work. The critical reagents for factor IX Sandwich ELISA are as follows: 1. Anti-factor IX. 2. Factor IX working standard. 3. Anti-factor IX antibody conjugated with HRP.
Marvelous. You've picked the critical reagents for factor IX Sandwich ELISA. I've prepared the critical reagents that you've picked along with other equipment for ELISA on Workbench 1. This is the overview of the factor IX Sandwich ELISA that you will perform shortly. 1. Coding 2. Blocking 3. Sample dilution 4. Probing 5. Detection start 6. Detection end.
Start the ELISA experiment. Go to Workbench 1. You are at the first step of factor IX Sandwich ELISA, which allows you to quantitate a specific target antigen from a complex mixture. Which antibody do you want to add at this step? Pick up the multi-channel pipette. Add the factor IX into the ELISA plate. In the real lab, you have to fill up the entire plate manually by yourself. Fortunately, you're in a virtual lab, so you have Marie to do this repetitive task for you. In this coding step, the capture antibodies are immobilized on the surface of polystyrene microplate wells. What type of force causes the passive adsorption of the captured antibody due to the interaction between amino acid side chains on the antigen used for coding, and the plastic surface? What are antibodies with high specificity that only detect one epitope called? Pick up the plate. Incubate the ELISA plate at 2 to 8 degrees Celsius in the fridge. You can incubate the plate for up to 4 days. In this lab, we will incubate it for 1 night. When the plate expires, our capture antibody will not be able to bind to the plate, therefore resulting in low or even no detection for all samples and controls. Pick up the plate. Discard the coating solution by blotting on the absorbing paper. Great work! You have applied the capture antibody on the bottom of the plate. The capture antibody will specifically capture the antigen. You have completed step 1, coding. Put the ELISA plate back on the table. Pick up the multi-channel pipette. Alright, now you will add blocking buffer to the ELISA plate. The purpose of blocking buffer is to block all sites that are unbound by the capture antibody. Therefore, no other proteins are able to bind to the plate and create false positives. Add blocking buffer from the pipette reservoir into the ELISA plate. The basic blocking buffer contains 5% bovine serum albumin dissolved in PBS. What is the purpose of adding a blocking buffer? Seal the ELISA plate using a microplate seal. Don't incubate the plate in the shaker during this blocking step. Wait for the incubation to remove the microplate seal. Blot dry the ELISA plate on absorbing paper. Now wash the dried ELISA plate using the microplate washer. Tween 20 is used in our wash buffer. What type of compound is Tween 20? Well done. You completed the blocking step. Blocking agents are used after the coating step to prevent nonspecific binding of proteins to the ELISA plate during the next steps. You have completed step 2, blocking. Put the ELISA plate back on the workbench. Pick up the pipette. Great work so far. Now we are going to load the sample into the wells. The ELISA plate has 96 wells, each of which can receive a different sample. In the ELISA assay we have standard, a known concentration antigen. The standard is used to create a standard curve, in order to determine antigen concentration in the sample. Control, known antigen, to validate results of the ELISA procedure. Test sample, a mixture with unknown antigen concentration. In this case, the sample is the factor IX product of human cell lines. Dr. Lisa has given us 3 test samples. The test samples, standard, and controls must be placed in specific wells to ease data analysis later. Here is the ELISA plate layout. Why do we have to load the samples into specific wells? Add 200 microliters of standard to well A1 using the pipette. What is the purpose of a standard? Add 200 microliters of test sample to well A3. Marvelous! You have added standard and test samples. The test samples are produced by human kidney cell lines, human hepatic cell lines, and human pancreatic cell lines. Add control to well A9. Pick up the multi-channel pipette. Quantitative ELISA includes a dilution series of known concentrations that are used to create a standard curve. This standard curve allows the concentrations of antigens in a sample to be quantified. The first well contains 200 microliters of standard with a concentration of 90 nanograms per milliliter. If we want to use a dilution with 1:2 dilution factor, how much sample should be transferred from the first well to the second well that contains 100 microliters diluent? Add assay buffer to row B. We will perform serial dilution with a 1:2 dilution factor. The concentration of the standard in the first well is 90 nanograms per milliliter. The aliquot volume is 100 microliters. The volume of diluent in well 2 to 8 is 100 microliters each. What is the concentration of the standard in well 8? Take into account that we are diluting the concentration to half in each step. Perform serial dilution with a 1:2 dilution factor. A positive control is a sample known to give positive results for the given test. What is the purpose of a positive control? In the real lab, you have to fill up the entire plate manually by yourself. Fortunately, you're in a virtual lab, so you have Marie to do this repetitive task for you. Great work! You've performed the serial dilution directly on the ELISA test plate. Place the pipette on the stand and seal the ELISA plate using a microplate seal. Incubate the ELISA plate on the plate shaker at 200 revolutions per minute for 2 hours. Wait for the incubation to complete. Place the ELISA plate on the workbench. Click on ELISA plate to remove the seal. Wash the ELISA plate on the microplate washer. You just performed the dilution of all samples, that is standard, controls, and test samples, using assay buffer. A proper dilution is paramount to the determination of antigen concentration later on in the process. If done improperly, the calculation of concentration will be invalid. You have completed step 4, sample dilution. Place the ELISA plate on the workbench. Pick up the multi-channel pipette. Nice. Now we're going to add the detection antibody. This antibody will specifically bind to our target antigen, factor IX, in the sample. Add the monoclonal anti-human factor IX conjugated with HRP to ROA from the pipette reservoir. Seal the ELISA plate. In the real lab, you have to fill up the entire plate manually by yourself. Fortunately, you're in a virtual lab, so you have Marie to do this repetitive task for you. Incubate the ELISA plate on the plate shaker at 200 revolutions per minute for 1 hour. Wait for the incubation to place the ELISA plate on the workbench. Remove the seal. What is the purpose of agitating the ELISA plate? Wash the ELISA plate on the microplate washer. Good work so far. You've added all critical reagents of factor IX sandwich ELISA. This is the configuration in the well plate. Do you want to measure the amount of factor IX now? Not just yet. We're actually missing one more step. Which step do we have to do next? Place the ELISA plate on the workbench. Pick up the multi-channel pipette. In the detection stage of ELISA, the enzyme converts the substrate into a detectable product. In this case, the product exhibit blue color. The intensity of the blue color is proportional to the amount of antigen in the sample. Add the TMB substrate to ROA from the pipette reservoir. TMB is Place the pipette back and incubate the ELISA plate in the dark container. Wait for the incubation to complete. Put the ELISA plate back on the examine the plate and raise the lab pad when you are done. Horseradish peroxidase catalyzes the reduction of hydrogen peroxide to water. In the presence of TMB, which act as hydrogen donors, the action of HRP converts colorless TMB molecules into blue. Pick up the multi-channel pipette. Add the stop buffer into ROA of the ELISA plate from the pipette reservoir. A stop solution is added to provide a fixed endpoint for the assay. What is the stop solution for the ELISA substrate TMB in the presence of horseradish peroxidase? Awesome! You have completed most of the ELISA steps. Stop solution is added to provide a fixed endpoint for the assay. In this case, the addition of sulfuric acid stops the reaction, turns the solution color from blue to yellow, and increases the absorbance. You have completed step 6 and 7, detection. Place the ELISA plate on the microplate reader. Set the wavelength to 650 nanometer, then press close and finally, press start. Let's review our experiment. We have performed factor IX sandwich ELISA. First, the plate is coated with anti-factor IX antibody. Then, blocking is performed with 5% BSA in PBS. Unbound material is removed by a subsequent wash. The factor IX standard, control, and sample is added. Remember that the standards, controls, and samples are added in different wells. The anti-factor IX antibody conjugated with HRP is added to assist detection. This detection antibody will bind specifically to the factor IX. The amount of bound HRP is detected by adding TMB reagent. A higher signal generated from HRP enzyme and TMB substrate correlates with a higher amount of factor IX in the samples. Addition of sulfuric acid stops the reaction after 10 minutes, turns the color from blue to yellow, and increases the absorbance twofold, which is measured photometrically. The color intensity is proportional to the amount of factor IX in the samples, which is determined against the factor IX standard. In the final factor IX sandwich ELISA reagents configuration, antigen is bound to the capture antibody which is attached to the well. The HRP conjugated detection antibody then binds to the antigen. Great work so far. You have performed the factor IX sandwich ELISA experiment. Marie has fixed any mistakes you made in assay by following the troubleshooting guide. Now it's time to analyze the data. Click on the PC. This is what the raw data of ELISA looks like. It shows the absorbance of each ELISA well. Click on the standard button on the PC screen. Generate the standard curve by pressing the 4 buttons for data fit, power, exponential, linear and log-log. Click Explore to access the graphs on the PC screen. A regression formula is obtained from the standard curve. This formula describes the relationship between concentration and absorbance data. We can use this regression formula to calculate the concentration of unknown samples. In this case, which regression type best describes our absorbance data? The equation of the standard curve is y equals 0.9988x minus 1.437. In ELISA we measured the absorbance using a spectrophotometer. How can we calculate the amount of factor IX in each sample? Alright, you know the basics of ELISA analysis. Marie will interpolate the amount of factor IX from the standard curve. While we wait, let's check your email. From Ms. Stauffer. Hello, I need your help for troubleshooting. My ELISA result looks weird. Click View Image to see it. All wells exhibit similar bright blue colors, even the negative control. What kind of problem do I have? From Senor Guzman. Hi, I have generated the standard curve for my ELISA experiment. Click View Image to see it. What do you think? Alright, Marie has completed the remaining parts of the data analysis. The average absorbance of each sample are as follows: human kidney cell lines, 8.2 human hepatic cell lines, 5.7 human pancreatic cell lines, 3.6. Good job. You have completed the ELISA lab. You have performed a method to quantify the amount of factor IX in the recombinant factor IX drug. The result shows that human kidney cell lines is the most efficient in producing recombinant factor IX. We could use it to produce a cheaper factor IX drug to treat hemophilia. Dr. Lisa and her colleague are pleased with your work.